Steve, thanks so much. 25 minutes after the hour, the CDC issuing a travel warning for expecting mothers, advising them to avoid 14 Latin American and Caribbean countries over a dangerous outbreak that could cause babies to be born with brain damage. The so-called Zika virus is spread to people through mosquito bites and is now inside the United States. A baby in Hawaii just born with the virus. So how scary is this? Fox News Medical 18's Dr. David Samadi joins us now with some of the answers. Thanks for being with us.
Good morning.
I just read a report this morning that in Texas there is one reported case as well for somebody who just returned from Latin America. How concerned are you about this?
I think right now we're seeing some random cases we've seen in Puerto Rico, Texas, and Hawaii. These are some of the people who have traveled to Caribbeans and South America. They have gotten the virus, and now the virus has traveled to America. Zika virus is actually a virus that's given from one person to another person through a mosquito bite. And a lot of times, Anna, it may not cause any problem. They may have some fever, joint pain, pink eye, etc. One of the big things that CDC just announced is the fact that in Brazil, they're finding out that on pregnant women, it can cause microcephaly. There's a lot of neurologic issues, cases of Guillain-Barrés that are all causing birth defects. And like I said, microcephaly is the head of the baby is really small and can cause a lot of neurologic and brain damage.
It seems like the hot spot, as you mentioned, is Brazil. I think we have a map that we can show just how the cases have grown from 2014 and then how rapidly it's grown just since October. If we can go ahead and show that.
It's a huge problem because we used to have about 147 cases, as you see, and now it's gone to thousands. And they are expecting that probably about 1.5 million people may have been exposed. But if you're pregnant, the answer is today is try to be careful about traveling to those areas. CDC basically is saying that, if you don't have to, don't go there, because if one of these mosquito bites, hit you, then you're going to be in trouble and you're going to have a baby that may be brain damage, and it's a big problem. There's no cure for this. There's no vaccine for this. There's no medication for this. And so the key is not to be exposed.
Right. Well, for people who aren't planning to travel any of these places anyway, or aren't planning on getting pregnant, this should still matter to them because we're not in mosquito season right now, right?
Exactly.
Summer's right around the corner. How concerned are you that it'll spread?
So I think that if you're going to see more and more of these cases, by the time we hit April, May, June, we may see an upsurge in this country also. We're watching this very carefully, but at the moment we're not seeing a huge surge in the United States, and that's the big concern.
This is not the last that we've heard of the Zika virus.
Important for pregnant women to know, to be very careful about traveling to those areas.
Okay. Dr. David Samadi, thanks for that recommendation.